Hello everyone, I am Urologist Erdem Akkaya. Today we will talk about why semen volume decreases or how to increase semen volume. First of all, semen is the liquid in which sperm swim. In other words, it gives very important properties to the sperm. It gives it properties that enable it to live longer in the vagina and fertilize the egg in the uterus. If there is any toxic condition in the semen, if the semen is contaminated, this is definitely reflected in the sperm. We see DNA damage, mitochondrial damage and consequently sperm immobility, lifelessness, and morphological shape changes in sperm. It can lead to infertility. This is very important. How much should the semen volume be? Semen volume should normally be around 1.5 to 5 cc. Before this is measured, the person must not ejaculate for 72 hours. When a person gives a sample without waiting that period, if the volume is below 1.5 cc, it should not be taken into account. Frequent ejaculation will cause a relative decrease in semen volume, not significant. You have to know that. Does it mean infertility when semen volume is low? No, it does not. A sperm test is absolutely necessary. But it should be known that the semen volume of infertile men is slightly less than that of normal men. I have to say that too. What are the reasons for the decrease in semen? We can explain this briefly as follows: the person's life habits, smoking, alcohol, caffeine, coffee, sleep disorders, lack of exercise, having a sedentary life will definitely reduce the semen volume in the first place. Also, sperm quality will deteriorate. For example, as the person's dietary habits move away from the Mediterranean diet and start to be more in the Western diet style, in the garbage diet style, as the weight gain increases and the testosterone level decreases, there will definitely be a decrease in semen volume. Apart from that, we also see that the semen volume decreases as the person gets older and prostate enlargement and prostate-related problems begin to occur. Apart from that, the medications used by the person. Of course, prostate medications are at the top of these. Prostate medications cause a decrease in semen volume. Both alpha blockers and 5-alpha reductase inhibitors can reduce semen volume, sometimes completely eliminating it. Comorbidities, such as diabetes, can cause dry ejaculation or a decrease in semen volume due to nerve damage. Imbalances in the person's sex hormones, especially testosterone, FSH, LH, estrogen, prolactin and thyroid hormones, can cause deterioration in semen volume. Prostate infections, microbes such as chlamydia, mycoplasma, ureaplasma, which usually enter the prostate sexually, can cause blockages and calcifications in the prostate ducts and a decrease in semen volume. These conditions reduce semen volume. Of course, surgeries, abdominal surgeries, colon surgeries, prostate surgeries, herniated disc surgeries, and surgeries related to the nerves coming out of the waist can all cause problems in semen volume. So what should be done to increase it? In order to increase it, first of all, the person should change his diet to the Mediterranean diet, and if he has a sleep problem, he should eliminate it. As I have just explained, the person should eliminate smoking and alcohol, eliminate caffeine and increase zinc in his diet. Zinc is very important for semen. There's an amino acid called taurine. Taurine amino acid is the most abundant amino acid in semen. He should eat a diet rich in taurine or take it from outside if necessary. If he has additional diseases, if there are medications he uses, if there are imbalances related to hormones, eliminating and correcting these will definitely provide an increase in semen volume. It will definitely provide an increase in sperm quality and sperm performance. It is also important to know that premature ejaculation can cause a relative decrease in sperm volume, semen volume. We need to explain it briefly as follows. When the person starts sexual intercourse, the area we call the bladder neck closes reflexively. And during intercourse, semen starts to accumulate in the center of the prostate. It builds and builds in volume. The longer the intercourse, the more the semen builds up and accumulates until ejaculation. When there is premature ejaculation, of course, the amount of semen that comes out will necessarily decrease because the phase we call emission will last shorter. But the longer the intercourse, the more the amount of semen will increase. It's a relative thing here. It may not be this way in everyone, but, when there is premature ejaculation, the amount of semen will necessarily be less. In today's video I talked about why semen volume decreases and what we can do to increase it. If you have any questions about this, if there are things I missed or if you want to learn more about the topics you are curious about, leave a comment. I will answer you in the comments. Thank you for listening, best regards.